All right, everybody. So we're going to go ahead and finish off the semester with chapter 23, the diseases of the genitourinary system. A lot of these are going to be the sexually transmitted infections, with just, I think, like one that isn't. So yeah, so let's go ahead and get into this. We already know the learning objectives. Again, this is the same stuff as before, but for the genitourinary system this time. So regarding the, parts of the genitourinary system. So we've got the whole urinary tract and everything involved in that, and then the genitals and reproductive tracts associated on that side. So it's sort of like two parts we've got going on here. In the urinary tract, the main function of it is to remove waste substances from the blood, regulate certain body processes, form urine and transport it out of the body. So here we are still including the kidneys as one of the organs as part of this. So don't forget them, that they can be involved in these. And then the genital system for reproduction, of course. So here's our urinary system. We've got our kidneys, the ureters, which are going to transport any product from the kidney into the bladder. And then we have a storage of the urine that we've been collecting from the kidney in the bladder itself, and then that will exit the bladder through the urethra. So that's the main parts of the urinary system. For the urinary tract, we have flushing action of the urine as a protective action. We also have desquamation of epithelial cells, so shedding the epithelial cells frequently and replacing them frequently. That will keep, any sort of microbes from being able to, really get a hold in there and adhere and start infection and growth there. Most bacteria adapted to adhere to the cells of the GI tract cannot gain foothold in the urinary tract because of the flushing as well as the desquamation rate of the cells involved here. Most of them, right? Of course, we've already mentioned about how most urinary tract infections are in fact caused by E. coli, which is from the GI tract, but we'll mention that here in a moment. We'll get into it soon. Oh, I promise. So the acidic pH of the urine affects the ability of bacteria to grow. There is presence of lysozyme and lactoferrin produced by cells associated with the tract. And then we have secretory IgA in the mucous membranes, those areas associated with, the genital area, essentially, as we go towards the outside of the urinary system. So of course, we're going to look at the male and the female, genital systems, reproductive systems. Most of you guys know parts involved with this. Most of the stuff that we're going to be talking about today, we're going to be referring mostly to like the penis as well as the urethra of males. We will be talking a little bit about the foreskin, not really like so much directly, but some diseases that you might be more susceptible to if you weren't circumcised, for example. So back to that. So we're also going to be talking about the prostate. That's what I'm trying to say. When we can have infection involved in that, which I think a lot of people aren't actually aware of. And so, the prostate gland being here, it's a little bit smaller than what people might think it would be, but it can get quite large if it does get inflamed, or of course, if there was cancer involved in there as well. And some of these diseases that we will be talking about, with what you think of like HPV, for example, is causing cervical cancer, can actually cause cancers in the male reproductive system as well. So I don't know how many of you know that. Hopefully that's something, you can be aware of for your future. So the female reproductive system, a lot of this stuff will be talking about the cervix. We talk about the uterus and the vagina. Some of these diseases will be affecting the outer external portions of the genitalia for females, so the labia minora and the labia majora, and like any other skin around the area as well, especially when we're talking about herpes. That can be not just on the actual mucosa or the actual reproductive tissues that we would typically think of, so keep that in mind as well. It's not always the obvious reproductive tissues that'll be involved in some of these sexually transmitted infections. I think that's, oh yeah, and the ovaries as well. When we talk about some of these diseases do in fact cause inflammation of the fallopian tubes leading up to the ovaries. So that's an important thing to consider, because they can lead to, if we have scarring from that inflammation, can lead to ectopic pregnancies or even infertility. So defenses of the female reproductive tract, this will vary over the lifetime of a woman, as of course the hormones change for women over time. There is a protective covering or secreted mucus over a lot of the mucous membrane associated with the female reproductive tract. We also have presence of secretory IgA, and that's the antibody that we associate with the mucous membranes. The low pH of the vagina, start getting that acidic pH during adolescence, when we start going through puberty and start going through changes with our hormones. The biome for women in childbearing years will prevent establishment and invasion of microbes that could harm a fetus. So it's kind of, I don't want to say designed for that, but that is how it has become functional for women and during childbearing years. The microbial composition will vary among men and women. The female urethra is a lot shorter. It's about 3.5 centimeters long. It can act as a pipeline for microbes from the anus into the actual urinary tract itself. Of course, first usually is the bladder. For males, circumcision changes the composition of the known normal biota of the penis. Biota in the uncircumcised penis, this is what I was talking about previously. Biota in the uncircumcised penis is different than what you would see in a circumcised penis, right? Because you have a fold of skin over there that can hold in moisture, and different kinds of bacteria are going to be favored in that sort of environment. That makes sense. So some of the bacteria that are associated with growth as part of the normal biota for an uncircumcised penis can lead to an inflammatory response. And when you have an inflammatory response involved, it might not be irritating, but it just could be low level, that can increase susceptibility to infections. And in particular, when we're talking in this chapter about, sexually transmitted infections. So for the male genital tract, the normal biota of the urethra, of course, we're going to have lactobacillus and streptococcus. Anytime we're talking anything about any of these genital tracts, lactobacillus is a really, really common and very important one. And then we have streptococcus, and we see streptococcus whatevers all over the place, right? So they're not uncommon as part of the normal biota. The biota will shift when sexual activity begins for men. That is, I feel like, an obvious one, because now you're coming into contact with another person's biota, and that will cause your biota to change. It adjusts over time as you're exposed to different biota, and they could, change your own biota long term. So that's something to be aware of. Microbes associated with STIs, sexually transmitted infections, can take up residence in the genital tract. Vaginal, oral, and anal intercourse can harbor bacteria, and of course, different kinds of bacteria based on whatever sort of intercourse you're having. That can lead to vaginosis in females whenever you are having intercourse with females. So you can be transferring those bacteria to them. That's not uncommon. The uterus and the organs above the uterus. So now we're talking about the uterus and the fallopian tubes and the actual ovaries. That those areas should be sterile. There is indication there could be a biome associated with the uterus that can become involved with, pregnancy. But for your purposes, let's just consider those portions are sterile. Of course, we know that there is microbiome in the vagina itself. Most of us are aware of that, because if you can be having things like a yeast infection, or I'm telling you about vaginosis and vaginitis, and the displacement of bacteria and how the shift in bacteria can change these things for women. Well, there has to be bacteria there for that to change. So most of us are aware of that, right? So the vagina obviously has its own biome. So the vaginal canal, colonized by a diverse array of microorganisms. Lactobacillus is, again, one of the more important ones, and I absolutely want you to be aware of. It will lower the pH of the vagina. It's going to be fermenting glycogen, and therefore producing lactic acid as a byproduct. That's what provides the actual lower acid pH for the vagina. Right, and so it does seem to be microbiota associated with the exterior of the cervix. So the cervix on the side of the vagina, that makes sense, because if the vagina has a microbiome, you would expect the exterior portion of the cervix too. And I don't know if you guys, for some reason, are not aware of female anatomy, but once you go into the internal portion of the reproductive tract of a woman, you have the vagina, and then the cervix is kind of the part that's between the vagina and the uterus, and sort of is a thicker, firmer tissue that kind of opens and closes based on hormonal shifts in a woman's, hormonal cycle, normal monthly cycle. So that can make someone more, apt to be able to get pregnant or not as well. It's associated with that stuff, right? So that firmer tissue that's sort of like acting as the in-between between those two areas, that's what the cervix is, if you're not aware of what that is. And what it looks like is a donut, essentially. I mean, I'm not lying about that. So that's kind of what it looks like when you look up in there. The biota of postmenopausal women will remain stable over time. So once you have that shift of your hormones, after that, your biome's going to remain pretty much the same. Candida albicans is present in the healthy reproductive tract of most women, almost all women. That is yeast. And so you will have some normally. And it's sort of like what we had talked about with C. diff, how like if you take antibiotics and you kill off all of like your good normal bacteria in your gut, then C. diff, with its endospores that can survive things, it will overgrow and take over all those now newly emptied stadium seeds, like in my little analogy here. It's the same thing with yeast. If you take an antibiotic and kill off your normal microbiota in the female reproductive tract, now we have all these empty stadium seeds where the good bacteria like lactobacillus were sitting, and now they're open, but you didn't kill Candida albicans because it's not bacteria, it's yeast. So now it can overgrow, and then we can have symptoms associated with overgrowth of that yeast, like itching and smell and all of that. So that's what that's related to. So this is a chart that's going over the defenses of the urinary tract, the female genital tract, versus childhood and postmenopausal versus childbearing years, which are going to differ, of course, and then the male genital tract, the defenses for them, as well as the normal biota for them. So we already went over what I feel like is important for these, but here's a good chart to summarize that if you're interested. All right, this isn't going. You can go away anytime you want, buddy. There we go. Urinary tract infections. Urethritis, infection of the urethra itself. Okay, common one. Cystitis, that's infection of the bladder, also pretty common one, particularly in women, not as common in men, but it does happen, right? Signs and symptoms associated with cystitis: pain in the pubic area, frequent urges to urinate, pain during urination itself, cloudy urine, blood in the urine. You can also have a smell associated with the urine, and often has a sulfurness associated to it, or something else off from what you would normally smell. Pyelonephritis is whenever you have that infection moving up further into the actual urinary tract, so now into the kidneys themselves. We can have the normal symptoms of cystitis, because usually that's what happened first, right? Then that will be accompanied by back pain, especially lower back pain, and high fever. This can result in permanent damage to the kidneys as we have inflammation developing as your body is trying to, attack whatever microbes could be in that area. So if you do end up having what you strongly suspect could be a bladder infection, and then you start having back pain, please go to the doctor as soon as you can. Just get on antibiotics, because you don't want to have any lasting damage, and you definitely don't want to develop something like septicemia, which would be a little bit further down the road, but still you don't want that. All right, urinary tract infections. Escherichia coli, or E. coli, causes about 80% of urinary tract infections. These E. coli use adhesins, so things that help them stick to things, really adhesive, right? Attached to urinary epithelia, so the actual cells along the walls of the urinary tract. They exhibit motility, so they can move around quite well, and we've actually seen that in our own microscopes, yes. So they do exhibit motility that allows them to travel along the mucosal surfaces themselves. They are transmitted from the GI tract to the urinary system, and the way that you prevent this is there is a vaccine in clinical trials, but it's really hard to vaccinate against a specific strain of E. coli, which are more likely to cause UTIs, as opposed to all E. coli, some of which are in people's normal guts, So they do recommend drinking cranberry juice. to introduce more acidity into the urine that helps protect. And there are other molecules in the cranberry juice that will be transmitted, I don't say transmitted, but, moved into the urine that will make it harder for the E. coli to adhere. So that's the idea with that. Treatment, trimethoprim, which is sulfamethoxazole, so a sulfa drug. You can also treat with, that's preferred method of treatment. If you're allergic to that, there are other options available. And then we have phenazopyridine, and that's typically what us females might call azo. You can get it over the counter as part of azo treatment there, or you can get prescription versions from the doctor. It turns your urine bright orange and will stain everything that you touch pretty much. So don't wear your nice underwear if you're taking this. I'm just saying, you should be aware. Leptospirosis, this one is a non-sexually associated disease. We'll say UTIs aren't necessarily sexually, transmitted infections, right? But you're more likely to get them when you are sexually active. That's just a fact. So there's a lot of stuff going on downstairs to move stuff back and forth. So that's why that's more common. Zoonosis means, of course, exists in animals typically and can be transmitted to humans occasionally. This is associated with wild and domestic animals. We have a leptospiremic phase where the pathogen is in the blood and spinal fluid. Then we have the immune phase that it can go through, where we have mild fever, headache, and that's due to leptospiral meningitis. And then something called Weil's syndrome can develop, where we have kidney invasion, hepatic disease, jaundice, anemia, and neurological disturbances associated with the infection. Long-term disability and death can result from infection with leptospiridium. There is a vaccine available that you're supposed to be vaccinating your dogs for this. Right, Leptospira interrogans is a spirochete. We've seen spirochetes before. Borrelia burgdorferi, for example, talking about like Rocky Mountain spotted fever and stuff like that. And other diseases that are associated with tick-borne stuff, they often tend to be spirochetes too. But the spirochetes, the important thing to know about, like specifically with Leptospira interrogans, adhesins and and I do want to be clear because I just hit me all of a sudden. I did say Rocky Mountain spotted fever. Rocky Mountain spotted fever isn't actually caused by Borrelia burgdorferi. Rocky Mountain spotted fever is caused by Rickettsia rickettsii. I don't want you to get confused about it, but those two things just popped in my head as things that have similar shapes. So that's, sorry, I didn't want to be confusing about that. So adhesins and invasion properties allow the pathogen to rapidly penetrate the host cells and enter the bloodstream. So again, we have presence of adhesins here that are helping the bacteria get into the host cell itself, right? And then these spirochetes, the spiral-shaped cells, can be shed in the urine of infected animals. They'll survive for months in neutral or alkaline soil and water. And so we treat any infection with this using doxycycline, penicillin, ceftriaxone in the case of severe diseases. So that wouldn't be a normal one that we go with, but only if it became serious. When we're talking about meningitis, for example. So that's leptospirosis again. Okay, so now we're going to be getting into the sexually transmitted infections. I do want to point out here, when we are talking about some of these, we already talked about HIV previously, so that's not one we were going to be talking about in this particular talk. Talk about HIV, didn't we? Yes, we did. Cardio. So we have human papillomavirus, clearly the leader here, right? Human papillomavirus, that's HPV. That is the #1 most common sexually transmitted infection in the world. It's super, super common. And we are going to talk a little bit about it towards the end of this chapter when we're getting into cervical cancers. We'll bring it up then. Not all strains of HPV cause cervical cancer. Not all strains of HPV cause genital warts, but genital warts are caused by HPV, to be clear. So we'll talk about that. Then we have herpes simplex type 2. So those are our two viruses that are the most common. We've already mentioned about herpes being very, very common, right? Then after that, we have trichomoniasis. So it's our trichomona. And then we have chlamydia after that. Chlamydia is a reportable sexually transmitted infection, so is the most common reportable one. So the one that the CDC and other like the WHO would be tracking or interested in tracking the spread of. And then HIV, gonorrhea, and syphilis. Gonorrhea might be one that would be at the top of our concern list, and we'll talk about why in a moment. So vaginitis. So when we talk about vaginitis and vaginosis, vaginitis, anytime you hear itis, I want you to think of inflammation of the thing that the word is associated with, right? So vaginitis, so vagina, inflammation, okay? So signs and symptoms, literal inflammation of the vagina, characterized by some degree of vaginal itching, burning, and discharge. Vaginitis itself, in this case, okay, vaginitis is not linked to the development of PID, which is pelvic inflammatory disease. And the reason I'm bringing it up is because a lot of them are, and I'm trying to like help you guys remember which ones are and which ones aren't. But so vaginitis is not associated with pelvic inflammatory disease. However, it is the one that causes inflammation of the vagina. So vaginitis, inflammation of the actual vagina, is caused by one of two things, typically Candida albicans, which is our yeast infections, or Trichomonas. Okay, so start off with Candida albicans, yeast infections. The yeast will grow in thick curd-like colonies in the walls of the vagina. It's an opportunistic infection, again, usually due to disrupting the normal biota. That can be due to taking antibiotics for something, or due to, having sex or something like that. That can also throw off your actual biome, right? Using, douches and stuff like that, don't recommend that. Topical and oral azole treatments will be used to treat vaginal candidiasis. So remember, the azole drugs, things like ketoconazole and stuff, the azoles are antifungals. So yeast is a fungus, so don't forget that. So back to this Trichomonas. We saw this one in the lab. This was on the lab midterm. Trichomonas vaginalis. It is a small pear-shaped protozoa. It causes asymptomatic infection in 50% of females and males. So half the people aren't going to have any symptoms at all. In females, we will, if we do have symptoms, have white to green frothy discharge. Women who become infected during pregnancy are predisposed to premature labor and low birth weight. It is the most common non-viral sexually transmitted infection, which we showed in that previous slide. Now, I know it was like 2 slides ago, but do you remember the most common overall infection of all of them? Think about it real quick. Let you think about it real quick. I'm sure you're recalling it right now, right? HPV, right? Human papillomavirus. All right. So metronidazole is the drug of choice to treat Trichomonas vaginalis. Again, metronidazole is often used to treat protozoal infections. So anything caused by protozoa, that's a pretty common one for treating this. All right, vaginosis. So now we are talking about having an infection going on in the vagina. This is not vaginitis where we have inflammation of the vagina though, okay? So this is not having inflammation in the vagina itself. Producing discharge will have a fishy odor. Itching is also common here. It's most likely to result in reduction of lactobacilli. It's most likely the result of the reduction of the lactobacilli in the vagina. That can be due to things like, sexual contact. I don't mean like it's being transmitted. That's kind of throwing that off. But like throwing off your biome because you're having sex with a new partner, or you're, using douches to clean up after yourself or something like that. Can all throw off the normal balance of how much lactobacilli you would have in the vagina. So now we can have overgrowth of other organisms, other bacteria typically in the vagina itself. So it's a mixed infection typically. This one can lead to pelvic inflammatory disease, infertility, ectopic pregnancies. It's often associated with PID, okay? This is not sexually transmitted, but it is, again, more common in sexually active women because of everything I said previously. Prostatitis. Now we're getting into a little bit of what the men can see. Inflammation of the prostate gland. Again, itis being inflammation of prostate here. Acute versions, we will almost always be caused by bacteria from the normal GI tract that somehow got into like the urethra and penis, probably during sex. and then travel up through the system into the actual prostate to lead to inflammation of the prostate gland. Chronic prostatitis can also occur. That will also be caused by bacteria, but typically at this point they've caused biofilms to form. So they grow in those little layers and communicate with one another to tell each other how that's doing. That is more difficult to treat. So it's usually unresponsive to typical antibiotics that would be used to treat the acute versions. Signs and symptoms of prostatitis include pain in the groin and lower back, frequent urge to urinate, difficulty urinating, blood in the urine, and painful ejaculation. Moving on to gonorrhea. Like I said, we're going to talk about this one specifically, so we'll get into a little bit of detail with this one. Gonorrhea signs and symptoms for males. We will see urethritis, painful urination, yellow discharge, and in many cases, this will actually be asymptomatic for males. For females, we have mucopurulent or bloody vaginal discharge, painful urination, salpingitis. So itis, again, inflammation, and salping is referring to the fallopian tubes in this case, okay? Inflammation of the fallopian tubes themselves. Pelvic inflammatory disease is often going to occur along with gonorrheal infection that's not treated early. So children that are born to carriers of the gonococcus, which is the causative agent of gonorrhea, can be infected as they pass through the birth canal and lead to blindness. So this is not, so I was going to show it right away. I thought it was, but no, we're going to do this first, apparently. Scar tissue in the fallopian tube. I was just going over these slides. You'd think I'd remember. Scar tissue in the fallopian tube can lead to, whenever you have fertilization of the actual egg early on, sort of towards into the actual fallopian tube. It's supposed to migrate down into the uterus and, plant itself in the uterine wall and grow into a baby and all that. If it can't migrate properly out of the fallopian tube, then it will get stuck in the fallopian tube and grow there instead. And that can be a very serious problem for the mother, and the baby is almost always going to have to be terminated in order to save the mother. So, and will often lead to death if it goes too far, because the fallopian tube can burst and that can lead to bleeding. And it's just, baby isn't meant to grow outside of the uterus. So it can lead to all sorts of complications. So that can be very dangerous. And gonorrhea is associated with forming the scar tissue in the fallopian tube that can lead to that. All right, that's ectopic pregnancy. Right, so gonorrhea is caused by the gonococcus. So we've mentioned, Neisseria organism species before. Neisseria meningitidis, that one, that's called the meningococcus, right? So this one's the gonococcus. Neisseria gonorrhoeae, pretty straightforward. They both kind of say what they are, right? That's easy. So they're both diplococcus, they're both gram-negative. Neisserias all are going to be diplococcus and gram-negative, okay? This one's the gonococcus, it's causing gonorrhea. It has fimbriae, so those are sort of, they look like flagella, but they aren't for movement, they're for attachment, okay? So they have fimbriae to attach to the mucosal epithelial cells, so the cells that are lining the mucosa of this, the reproductive tracts. They have phase variation that confuses the immune system. So that just means they are changing the proteins on their surface to keep our immune system guessing. They're transmitted through all forms of sexual contact, whether we're talking about, male, female, penis, vagina, or if we're talking about male, male, if we're talking about, anal sex, or if we're talking about oral sex, whatever, it wouldn't matter. It's transmitted through all forms of sexual contact. Infection with this can increase the risk of HIV infection. Now, this is not unlike what we had mentioned previously with uncircumcised males, how they have a different normal biome than what circumcised males have. So different bacteria, and the bacteria associated with being uncircumcised can lead to inflammation that can make you more susceptible to some sexually transmitted infections. Remember that? Because that was the thing I said. I hope you remember that. So this is the same kind of concept here. So if you have gonorrhea, you're going to be having a lot of inflammation in the area of your reproductive tract, whether you're male or female. So you're going to be at higher risk of actually getting HIV if you are having sexual contact with somebody who is HIV positive when you have gonorrhea already. So that's what that's referring to there. So you're at a higher risk of getting HIV because of that. A large percentage of isolates of gonorrhea, the Neisseria gonorrhea gonococcus, these are resistant to penicillin and fluoroquinolones. And in Japan, we found strains that are in 2011, which is feels like a long time ago now, right? 12 years ago, they found strains that were resistant to all commonly used antibiotics. So this is what I was saying about it being important to be aware of what's going on with gonorrhea right now, because gonorrhea is probably a bigger concern as far as antibiotic resistance is going, even compared to MRSA, because these guys are more resistant. So next we have chlamydia. So we had mentioned that chlamydia is the most common reportable infectious disease. Again, the one that they're actually keeping track of with the CDC and everything like that you would call about in a clinic. Signs and symptoms associated with this. Males will have discharge and painful urination. Females, about 75% of females will be asymptomatic, won't even know they're carrying it. Those who do have symptoms will have cervicitis, again, inflammation of the cervix, discharge or salpingitis, again, inflammation of the fallopian tubes, and then PID, pelvic inflammatory disease. We can also see development of lymphogranuloma, venereum, that's invasion of the lymphatic tissues, specifically those that would be located near the actual reproductive system. Then we can have development of headache, fever, and muscle aches associated with infection with chlamydia. Oh, and this chart down here is just showing over time from 1984 up to 2014 incidents in the United States. And then the black line is representing incidents of chlamydia in Oklahoma. So when you see it start popping up, I started keeping track of it in 1990 or something. It just is climbing up just right along with the rest of the United States. So we've dipped the past few years, but still. Okay, so chlamydia is caused by Chlamydia trachomatis. This is a small gram-negative bacterium. It is an obligate intracellular parasite. Now, I'm hoping that you guys by now know what obligate means versus facultative, but obligate, you are obligated, you have to live inside of something. Okay, so they are obligated to be intracellular parasites. Intracellular means inside of the host cell, and parasite means that they're depending on the host cell for, food and energy and stuff. So obligate intracellular parasites, they have to do it. Facultative would mean that they can, but they don't have to. So cell wall of chlamydia actually prevents the phagosome-lysosome fusion. We would consider that an aspect of that to be a virulence factor that is allowing it to, take hold and cause disease in its host. So the phagosome-lysosome fusion, that's whenever the phagocytes, monocytes, macrophages, whatever, are coming around and eating up foreign bad guys, and nor they eat them up and put them into a little vesicle inside of the cell, and then that's the phagosome, and then they merge with the phagosome something called a lysosome that has lysozyme in it, and I don't know if you remember what lysozyme is, but it's an enzyme that breaks down. I know you know the answer. Peptidoglycan. Okay, and so peptidoglycan, that is a molecule that makes up the cell wall of bacteria. So, so that's supposed to, combine with the phagosome that we just put the bacteria, the chlamydia into, so they can, start killing the bacteria. And there's other stuff in it too. But these guys prevent that from merging. So that's kind of interesting. So there's broad distribution in the population with infections that are steadily increasing. And then we have treatment of chlamydia with doxycycline and azithromycin, and co-infection with gonorrhea. So chlamydia plus gonorrhea is usually pretty common. Okay, moving on to syphilis. This is an older disease, right? We've heard of this guy. A lot of us are familiar with not just the idea of syphilis being a sexually transmitted disease. We all know that, but it being associated with dementia, right? So people would have it for so friggin' long that they would develop dementia eventually as it passed through those phases that you'll go through with syphilis. And you may not be aware of the phases, and we're going to go through those. today, but the advent of our discovery of penicillin was one of the biggest things that could happen to helping, treat syphilis and make it a far, far less common sexually transmitted infection. So it was first recognized at the close of the 15th century. So 15th century, we're talking about the 1400s. Scholars have concluded that syphilis was introduced in the Old World from the New World. The French called it the Italian disease, and the Italians called it the French disease because, of course. In 1932, there was a study done, the Tuskegee, and this was Tuskegee, Alabama, Tuskegee study of untreated syphilis in the Negro male. So here we are talking about African-American men that were made to go through unethical epidemiological study against kind of, I don't want to say without their consent, they got their consent, but they weren't really educated on what they were signing up for the consent of. So I don't want to say they were lying about it, but they basically were, right? So they were not accurately describing what was going to be, done with these men. Basically, they just studied the progress of syphilis in men who had syphilis and did not treat them just to see what would happen. It was a 40-year-long study, very, very unethical, kind of disgusting, not kind of, very disgusting behavior on their part. So good job, guys. That was the worst. So that's the Tuskegee study of syphilis. Be aware of that one, and that will probably be on the test. Pretty sure it is on the test. Yeah, so they didn't treat them. They just wanted to see what would happen if they watched. So talking about syphilis itself, yes, there's going to be pictures. So primary syphilis starts off, this is the first kind of phase. There's essentially 3 phases involved with syphilis, but the last portion is a little bit more gray area, okay? So primary syphilis, you always start out with a canker. So canker, this is a small red hard bump, typically pretty firm bump that appears at the site of entry of the pathogen. So you can have sometimes one or more, but it's not like you have them all over the place. So a hard red bump, internal or external genitalia, lips, oral cavity, nipples, fingers, around the anus, wherever the actual bacteria would be getting in. So yeah, wherever you had the contact with bacteria got in, where you got infected from, that's where you will have the canker, okay? Okay, so the canker exists for a little while, then eventually we will become secondary syphilis. Secondary syphilis consists of fever, headache, sore throat, normal kind of sick with something, symptoms, lymphadenopathy, so swollen lymph nodes, red or brown rash on the palms of the hands and soles of the feet. Very, very, obvious relation to syphilis. This is a very common symptom that we see in secondary syphilis that is almost directly tied to syphilis, especially when you consider the progression of the disease. Development of canker, if you are, well averse as far as recognizing canker and what it would represent, then you can tag the syphilis early on and know that that's what it is, just by sight, just by seeing that. But if you haven't, or you didn't notice it for some reason, that red brown rash on the palms and soles and the back and whatever, very, very characteristic of syphilis. Okay, this can often be associated with hair loss. Okay, so over here we have some pictures of cankers that are associated with the syphilis infection, and then we have the presence of the rash that I was talking about. And these other ones. So these are very characteristic of syphilis, especially on the palms and the feet. All right, then we have the latent and tertiary syphilis. So we've been hanging out with it a little too long. That's what's going on here. We should have treated it a while ago. Damage to small arteries and the aortic wall. We have development of gummas. These are just soft swellings of tissue. They literally just like soft lumps in areas associated with this. So typically in the liver, skin, and bone. Neurosyphilis, headaches, convulsions, atrophy of the optic nerve. So you start losing vision, start developing dementia, and then something called the Robertson, pupil. I don't know much about that, but I imagine that it has something to do with the change in your pupil size or something, or response. So Yeah, so most of us have heard about the dementia portion. Like if it goes too long, you definitely do develop dementia, and that also is a characteristic sign of later phase syphilis. So there's those symptoms. There's also something called congenital syphilis. So whenever the mother has syphilis and passes it on to her child, this will inhibit fetal growth and disrupt critical periods of development with lasting effects that can be seen into adulthood. It can cause fetal abnormalities to spontaneous miscarriage, as well as stillbirth associated with this. So here on the left, we'll start with this. These teeth, you see how they have this weird shape, like they're spaced out and they've got this weird like shape going on with them, sort of stunted. That is, this is an adult. That would be, or it could be a child, but I'm pretty sure it's adult due to the decay in the back teeth. I'm just saying. That had been born to a mother that had syphilis. And these are permanent effects that are seen in adults. It's like Hutchinson's teeth, I believe is what it's called. Yeah, so that's a sign that you were born to a mother that had syphilis actively when you were born. And this baby on the right was born to a mother with syphilis, and you can see clearly a lot of like mucus and inflammation associated with exposure to the bacteria. Syphilis is caused by a bacterium called Treponema pallidum. It's a thin, regularly coiled cell with, again, more coiled up cells, right? With a gram-negative cell wall. So it's gram-negative, it's thin, it's coiled. There you go. I mean, I don't know. They bind to epithelial cells. They have a hooked tip, and that allows them to like kind of hook on to cells. So that's how they will adhere. That's a virulence factor. The outer membrane lipoproteins, so proteins that are associated on their outer membrane, stimulate a strong inflammatory response. And that can lead to, when we're trying to attack with our inflammatory response, the bad guy, lead to causing damage to our own cells that are nearby or associated with the infection. Risk of infection is about 12 to 30% per sexual encounter. And this is referring to per sexual encounter with someone who has syphilis. Okay, just don't worry. The person has to have it, you know. So risk of infection is about 12 to 30% per sexual encounter with somebody that has the infection. Barrier condoms, so it doesn't 100% transfer. Barrier condoms provide protection from the spread of syphilis. Penicillin is the drug of choice for treating syphilis. All right, moving on to cancroid. This is caused by the bacteria Haemophilus ducreyi. This is a pleomorphic gram-negative rod. It forms a soft canker, much larger than the canker than what we see with syphilis. It's very painful in men, although women may not notice it at all. It's common in the tropics and the subtropics, transmitted through direct sexual contact. And I say it's common overall, like everywhere, it's not common. But in the tropics and subtropics, it can be in areas where, they're not well, educated on how to prevent these things. So it's usually transmitted through direct sexual contact. It's associated with sex workers, poor hygiene, and uncircumcised men are more commonly affected. We already talked about that. Azithromycin and ceftriaxone, again, are effective in treating this bacterial infection. All right, genital herpes. This is caused by herpes simplex viruses. We have HSV1 as well as HSV2. Both of them can cause genital herpes, and really both of them can cause oral herpes as well. Why? No. Whatever. Okay. We more typically associate, cold sores with HSV1, but they can be caused by either one of these. Okay. Same with genital, either one. But we primarily talk about HSV2 in these cases. So signs and symptoms include single or multiple vesicles on the genitalia, perineum, thigh, and buttocks. Vesicles are filled with clear fluid and intensely painful to the touch. Recurrent episodes of lesions occur due to viral latency. So the virus will go hang out and hide out into the nerves and then pop out whenever, there's periods of stress typically. And rarely you can see, and we have talked about this already as well, that herpes viruses can cause encephalitis. Not common though. We could talk about herpes keratitis as well. Herpes keratitis being, with the eye keratitis. If you had transfer of like oral herpes, towards the actual eye that would lead to development of keratitis, but that again is not that common. All right, so you're infected with herpes, you have the virus, and then that's in the skin, and then you will move down through the actual nerve and hang out in the ganglion, which are these swellings along the nerves, where they can hide out and incorporate their little DNA into your DNA, and then become latent, and then wait for, stress to come and kick you back out. Okay, for babies, this occurs whenever infants are contaminated during birth. Infections of the mouth, skin, and eyes of the babies when they're being born will have a 30% mortality rate. Infections of the central nervous system when a baby is being born to a mother with an active infection, 50 to 80% mortality rate. Again, that's whenever it ends up affecting the CNS, if it moves into that. Any evidence of outbreak at the time of delivery will necessitate a cesarean section, even if your birth plan, talk with your doctor. You want to have, a natural birth. The doctor goes down to check out how far you are along as far as, your cervix. And they will see that you have an active herpes outbreak, and you don't get a choice about it. Typically it's cesarean or, the highway, I don't know. So genital herpes, these viruses are DNA viruses with icosahedral capsids. I don't know if you guys are forgetting what that means, maybe probably by now. It means that there's like triangles essentially that are making up a circle shape overall. So that's what their protein capsid looks like. Your choice really with viruses, typically icosahedral capsid, or you can have the helical capsids. So that's what you would see with like Ebola, really long, the long ones. So those can also wrap up inside of envelopes though, so keep that in mind. They have envelopes, these viruses do, herpes viruses, and those envelopes have spikes on their outsides that allows them to get in and out of their host cell, or into their host cells. The viruses become latent in the ganglion. We already said this. Reactivation through stress. We already said that. That stress can be caused by UV radiation injury, menstruation. That's going to refer to any hormonal changes at all in the reproductive tract, typically, closer to where the original infection had occurred, or other microbial infection, of course, can lead to stress on the body too. Transmission is through direct exposure to the secretions that contain the virus, acyclovir, and derivatives related to acyclovir. Valtrex, for example, is one of those medications. See up in the upper right. Valacyclovir. So that's what the actual medication is for Valtrex. So acyclovir derivative. These will reduce viral shedding and the occurrence of the lesions, but they are not curative. So remember, herpes is forever. So far anyways, I don't have a cure yet. So moving on to talking about cervical cancer. Okay, so human papillomavirus is a sexually transmitted infection. 90% of all HPV infections will be cleared naturally by the body. HPV is also the causative agent of genital warts, same virus. There's just a lot of different strains. Some of the 40 types, there's over 40 types of HPV. Some of those over 40 types cause genital warts. Some of them cause cervical cancer. Some of them might have no symptoms at all. Some of them might have like both warts and cancer risk. So there's a lot of overlap there is what I'm trying to say. So they don't all only cause cervical cancer either, right? So they can also cause penis, anus, vulva, head, and neck cancers as well, which I don't think most people know about that, but now you do know it. So the pap smear test is very effective at controlling this and has just drastically reduced the number of cases of actual cervical cancer that we do see. We start with taking scrapings off of the cervix of sexually active women and looking at them in the microscope for any abnormalities. And we see abnormalities, we can basically rate it based on what kind of abnormality it is, whether we think it's actually like precancerous or just abnormal, HPV infected cells up to cancer cells. But typically we catch it well before cancer and can remove tissue or even, whole biopsies or all sorts of burning off areas that could be potentially cancerous or removing parts of the cervix to help protect that person from developing cancer. Eventually, over time, many women will clear the virus, even the cervical cancer versions, even if they were having positive PAPs, they can just go to having negatives for the rest of their life after that. So they're, keep up with the PAPs. Cervical cancer is the 5th most common cancer in the world. It's the 2nd most common cancer in the developing world. In the United States in 2014, 12,578 women were diagnosed and over 4,000 women died from cervical cancer. So it is still a concern. How this all works, you can get infected, you have normal epithelium of your cervix. You get infected with the virus. The virus comes in and starts developing and growing. That can lead to grade 1 intraepithelial neoplasia. So that's some sort of like a lesion associated with having been affected by the virus and having cells starting to grow abnormally. Grade 2, we have the cells that are starting to grow abnormally that are now quite visibly growing away from their normal contained like zones. So we're growing outwards and growing inwards as well into the actual basal layer. Grade 3, we have the basal layer affected, we're growing outwards, and now we're seeing increased incidence of cells that have the actual nuclei with integrated viral DNA in the nuclei and not just being infected by the virus, but now the virus has incorporated its DNA into the genome of the host, which is like what we talk about with other latent viruses, right? So start seeing that with grade 3, and then invasive cancer develops as those cells continue to cross over the region that they should be growing in and crossing over the basement membrane and into the dermis and further beyond. That's progressive of that cancer. So this is showing this in the terms of the actual cervix itself, whether you're looking at it straight on or you're looking at the cervix, typically, like I said, shaped like a donut. And you can start seeing the actual abnormal cells growing and then spreading beyond the actual cervix once we start having cancer developing. Depending on how far it is past the cervix or how involved the cervix is even, and where it is actually, having growth. So here in the last one in stage 2B, this picture, you can see the perimetrium is being invaded by the actual cancer cells of the cervix, moving out into areas that are no longer necessarily associated directly with the reproductive tract, right? So that's very abnormal. So based on that is how they would stage the cancer. There are vaccines available for HPV. This is Gardasil or Cervarix. It's a subunit vaccine, and we produce this in yeast. We have genetically engineered yeast to produce, these subunits that we will allow us to react to those subunits of the virus. So like proteins or something associated with the virus, we develop antibodies against those. And so when we see the actual virus as a whole, the next time we can react to those subunits as parts of the virus. So that's how that works. There were some adverse events associated with this. I'm not going to play the video right now, but you are more than welcome to look at that or the actual adverse effects of associated with those. But so at first we were using the vaccine could target type 6, 11, 16, and 18 HPVs. These are the most common viruses, but didn't cover all of HPVs that you could possibly get. Then we came out with Gardasil 9, which we'll talk about in a second, but that covered 9 different forms of HPV. It was recommended that boys and girls would get the vaccine, not just girls, boys and girls, because boys can transmit it, right? So only boys get infected. I want to be clear about this. Even if they're not having, penis cancer or anal cancer or whatever, you can still be infected and you not necessarily even have genital warts. You could be spreading it without any symptoms. Yeah, believe me. So, so they wanted a vaccine for boys and girls that were ages 13 to 17, but parents didn't believe that their child they didn't think their child needed the vaccine. Do I need to say it? I don't think I need to say it, do I? Yeah, I don't know what world they're living in. So fantasy, that's a fantasy. I don't know what world you lived in as adults, but yeah, they thought their children were too young and innocent for that sort of thing. They didn't need, sex, vaccine for their child. fantasy. So, you know what I mean here. Or I could go on forever about it. So 75% of HPV cases, of all like HPV that we transmitted sexually, 75% of the time, you're going to get that in adolescents under 18. Just saying. So, okay, so now we have expanded this. Luckily, this started out in just 13 to 17-year-olds, and now adults can get it. 27 to 45-year-olds can get it. At first, they were saying it was, ideal that you not have had sexual contact before you get this vaccine, and now they're saying it covers enough of the HPV, strains that even adults who have been sexually active, typically you have been by the time you get to 27 to 45, you can cover against other possible HPV types that maybe you haven't gotten yet. So that's the idea with that. I think is great. So here's the idea where we had the 4 that we were treating before with the original vaccine, and now we've moved up to 9 types. So the 4 did cover about 70% of the kinds of viruses that would cause cervical cancer. Now we are covering 90% of them, which is excellent, right? A much better. In the case of anal cancer, we were covering 85% of viruses that, HPV viruses anyways, that caused anal cancer. Now we're covering 90 to 95% of the strains. So I think this is great progress that we've made. Also, 90% of the strains that can cause genital warts are still being covered by this. And I just think that, I just think that's great. So that's it for the genitourinary stuff. And that's it for microbiology. That's all the lectures that I have for you. Here's all the diseases that we talked about in this chapter. And of course, while you're studying and going back and looking at the other ones, I think it would be a great idea for you guys to go ahead and start maybe making flashcards of these diseases and try to categorize them, whether, make a category for like bacteria and put all the ones that are bacteria in that category, or even break it down maybe to gram positives and gram negatives, the ones that cause encephalitis, the ones that cause, and just have your whole list and try to like organize it out in all these different ways. I think that would probably be the best way to start studying this, to be familiar with the names of these diseases, like, if we're talking about syphilis, and then having to know the actual organism that causes it, like Treponema pallidum for syphilis. So that's where I would start. I would start working on flashcards for that, being familiar with the basics of each disease and then being able to like sort them into categories. That's great. I know that the study guide isn't like this super like best study guide. It's like name the diseases and like the symptoms and the causative agent. It's for every single disease that you did on all the chapters. And I know it sucks, but I don't know how to break it down any more specifically than that, because, of course, that's what you're supposed to learn from these chapters from Unit 4. So I'm sorry about that. That's just the way it played out for this unit. But thank you guys for sitting through these videos. For those of you that did watch them, I appreciate it. And I hope you got something from this course. Don't forget to fill out your, I don't know what to call it, the review assessment thingy quiz thing for your extra credit, number 1. Number 2, because I really do appreciate your feedback. Please put whatever feedback you have about the course on there. It actually means a whole lot to me, and I do want to improve the course as much as I can for future sections. So let me know. It's all anonymous, so I won't know if you do say something that you hated about the course. It's okay. I want to know. So yeah, thank you guys. And if you have any questions about any of this while you're studying, or even questions after you've left the course and you have a question about something to do with microbiology, and you're still hanging around campus, come see me and I'll be happy to chat. All right. Thanks, guys. Hope I see you around.